with you, Joint Commission Jurassic Park Geriatrics.
Oh,
Welcome
wow.
to this week's episode of 3PTs in a Pod. This week's episode is all about clinicals. So we are just about to start our second full-time clinical within our curriculum. So this week's episode is a discussion all about how to make clinical the most successful experience you can. We'll share our experiences and we'll see where else the conversation leads.
Word. Word. Let's do it.
All right.
Get to it.
So what's up, boys? Just had 4th of July, checking in post 4th of
Independence Day.
July, USA. Sure. So yeah, clinical starts Monday. Any thoughts on that?
Exciting times. It's
Yeah.
exciting times. Time to get your put all your knowledge to use.
Exactly. Yeah, just finished our summer semester. Everyone make it out of finals okay?
Hopefully. We don't know yet.
Yeah. Well, we got one back.
Yeah.
Yeah. And
Grades are up?
grades are up?
Grades are up.
I heard him talking to a few people, so it sounded like there were a couple remediation papers possibly happening.
Ooh.
Wait, when?
After the final.
Oh, geez.
Yeah.
Oh, geez.
We won't blow up anyone's spot, but it was.
It rhymes with. What does it rhyme with?
I'm not good at rhyming.
Slammy.
So. I don't know.
It's one of your major leg muscles.
Rhymes with that. So anyway, so we made it hopefully through the summer semester unscathed. Now Monday starts clinical. So this is our second full-time clinical, right? I guess some programs would just be having their first full-time one, their second.
Yeah.
And we've also had 4 part-time clinicals.
Mm-hmm.
So this is
which don't count.
Right. It just, 1 or 2 days a week for, 6 weeks. So technically our 6th overall clinical experience, but really our second full-time one.
Yeah.
So I thought what we'd start with is in preparation for when we were going to originally record this episode, I made my own Jocko style dichotomies of clinical. So
was this one on one of your walks?
This was on one of my cardio morning walks, yes. One of my treadmill walks. Put this little list together. So basically for those of you out there listening now on iTunes who don't know about Jocko Willink or his book, Extreme Ownership, he basically at one point in the book lays out what he calls his dichotomies of leadership. So couple just examples of his 10 that he gives. He says, as a leader, you should be, and he gives these dichotomies. So you're always sort of towing this line of a balance between these two. So he says confident but not cocky, competitive but a gracious loser, attentive to details but not obsessed by them, strong but have endurance. So he lays out 10 principles like that for leadership. Not going to lay out all 10, so you cheap fucks have to go buy the book. Support Jocko Willink a little bit because he's a big influence, I think, on a lot of our thoughts and beliefs, especially on what it means to be successful and how to go about that process.
Not an ad, though.
What's that?
It's not an ad.
Yeah, we're not getting paid.
Oh yeah, no.
Unfortunately.
No,
not yet.
If you do want to sponsor the podcast, please email us at 3ptsinapod@gmail.com.
And if you have any questions,
yes, and any questions, we'll probably take any sponsorship we get at this point. Even at chiropractic offices, if you'd like to sponsor the podcast. So anyway, I put together my list. I only did 5 because I'm not quite as impressive as Jocko, but I'll see what you guys think of these. So my 5 are: number 1, willing to listen, but not timid. So my thought there was like listening and being respectful of your clinical instructor and understanding that they know more than you, but being willing to step up to the plate and take action like without being asked. So you can't be this like timid, I'm a student. So I don't know, guys.
Don't wait for them to tell you to do something to do it. You know,
Yes.
I mean, it depends on the situation, but offer your help. Even suggest things that you think might be appropriate that they may not be doing or may not have thought of. They probably would appreciate that just to get a different perspective, you know, because you kind of,
Sure.
you know, everyone gets in their like rut and kind of starts doing the same things over and over again. And you kind of need an outside perspective to kind of break you out of that rut. So I think that's important for us as students, you know, because that'll help you gain confidence. If you suggest something and the PT thinks it's a great idea, you know, that'll make you feel good.
Exactly. Anything else on your end, KP, before I?
I was going to say something, but I have a feeling that you're going to hit it on the next, at least the next one. So I'll wait till the end.
And yeah, so another like minor point about that one that I wrote down too was even I think a lot of like clinical instructors, they want to let you do stuff, but they also are giving you their patience, you know, so they need to have a trust in you. And one of the things I thought about too is just like the most basic, easy things around the clinic, like your first week, like showing you're willing to clean tables and like take pillowcases off and put new ones on without having to be like, oh, can you like get those tables real quick?
Right.
If you're doing like minor little things like that just to build trust, they'll be much quicker to like trust you with their patients, I think. So just another little thought there. So number 2, I said takes direction, but doesn't expect everything to be spoon-fed to them. So somewhat along the same lines, but saying like ask questions and listen to the answers and use it to help sort of guide your patient treatment, but don't be lazy. Like look things up on your own. You have a question about something, don't just expect that answer from them all the time. Like be willing to go home at night, look things up that you might have sort of stumbled with a day, things like that.
Yeah, that's a good point. Yeah, I mean, questions is how you learn. If they might assume that you might know it, or you know, they might even think that you don't care. So asking questions kind of shows your interest to them, and the more questions you ask, the more willing they might be to help you. So I think that's a really important aspect and just part of the learning process.
For sure.
Yeah, plus showing them that you're willing to engage, unlike Matt Hoover. Shout out Kenny. That just opens up more like opportunities for you down the line. So if it's going back to your first point about being timid. If you know, the first week you're timid and shy, and then for the rest of the time they'll probably be like, oh, this person can't really handle a difficult situation, so you won't be put in that situation. And I think the best way to learn is to be uncomfortable. We've said it a bunch of times. So being like engaged and will give you more opportunities down the road with a tougher patient that you might not have been able to see if you weren't engaged like in week 1. So I think it's a good point.
Absolutely. Yeah, no, for sure. And first impressions mean a lot when you only have 6 weeks. So you stumble out of the gates week 1, like you said, you might not get some of the same opportunities that someone else would if you showed up strong right away. So going in prepared. Yeah,
you're in a race to build trust so that you can get build a patient caseload by the end and actually get hands-on experience. You know, if they don't trust you and you're observing for 3 weeks, then you only get, you know, the rest of the 3 weeks to possibly get your hands on patients. Whereas you know, you build trust for the first week. They might let you do some stuff the first week, and then you have, you know, 5 weeks of, you know, 10 to 12 hours of patient care, like a day or whatever your shift is.
Yeah, absolutely. All right. So number 3 of 5 is be competent with your hands-on skills, but able to form a connection with patients. So again, sort of that dichotomy between showing that you know what you're doing hands-on skill-wise, but also having the ability outside of maybe what we look at as like the main professional skills, but the ability to communicate with a patient, get that buy-in that's going to allow you to get more out of your treatment with that patient, was the third one.
Absolutely. And we kind of touched on this when we talked about that study where they compared just the stim to like the placebo. I forgot what it was called.
Therapeutic alliance.
Yeah, the therapeutic alliance, and like how powerful that was in creating in decreasing pain, even when like the stim unit wasn't on. So I mean, just listening to your patient, remembering things about them, like they might think that's nice, and just showing that you care. That's more important than any skill you could possibly have, in my opinion.
Yeah, I think displaying confidence with your hands is like crucial because they're buying into you as well. Like you kind of just touched on it, but they're paying to be there technically, like whether it's through insurance or whatever. They want like the best, obviously, to get better, but they also want like what their money's worth. So if they're not going to get the same kind of treatment from you as your CI, then they're obviously going to have a worse outlook on PT in general. So I think that's crucial, and I think that's one of the hardest things as a student too, because you're not going to be great at it for a while.
Yeah,
and it's frustrating, but
yeah, you're so focused on developing your hands-on skills that like you kind of forget that that's only part of the puzzle. Building a real connection with the patient and showing that you understand and that you care. That's a huge component that we might not focus on as much, but I feel like as you practice more, you realize that that's more and more important.
Yeah. And off of both of those things you guys just said, like KP said, you might be a little bit frustrated initially with where your skills are at because you want them to be better in terms of your hands-on skills, but you can sort of make up for that with being strong in your patient communication and having them buy into you as a person who's trying to help them versus just judging you and how confident they are in you on your hands-on skills. I mean, I don't care what you say. If you're a second-year student, you're not going to like blow some patient away most of the time with being some like expert savant physical therapist. So you need that communication side as well to sort of level out, being able to still give the same level of care that's going to make it worthwhile for them to come in. So.
Yep.
All right, we have number 4 is firm but compassionate with patient interaction. So my thought there was, again, you can't act scared because you're just a student. But you also need to tell patients what they need to do, give your reasoning, but be firm in like what you're telling them. Show that you're an expert on one end, but still have that compassion that they're there for some help, they're in pain. So towing that balance between those two things, which will overall improve, again, this sort of overarching aspect of like patient communication and buy-in and things like that.
Yeah, that's a big point, especially for if you're just starting out in clinicals. Like I remember last summer, I try not to act like I'm a student in the clinic. I try to act like I'm a PT in the clinic. Not that I, lie to patients and tell them I'm a PT and not a student, but during my summer clinical, I'm pretty sure half the patients didn't even know I was a student. And like when I would like eval a patient, I would introduce myself as, my CI student, and, whether they paid attention or not, like remembered or not, I don't know. But, when I would tell them later on that I was a student, they would act surprised because they, I eval them, I'm treating them. And that kind of comes down to showing confidence and showing that you know what you're doing.
Yeah.
And yeah, that goes into building trust of the patient. Because if you act like a student, like I'm not sure about this, like we haven't learned this yet, just kind of fake it till you make it, like we always say.
Yeah, and I think that goes up the last point as well. Sorry, Chris, but
that's all right.
It's yeah, it's just that interaction. I mean, there's no impression like a first impression. So like an eval, or whether it's your first day and they've been going for a while and you want to like get them to buy in and everything. Just like being confident and being firm, like you said, that patient that first time is going to change everything down the line. So
KP,
Yeah.
if you cut Chris off again, I'm gonna mute you, dude.
I mean, I'm the manager, so
Executive level management.
that's just a power move.
Yeah, I just
Flexing on him.
You just got cucked.
just got fucking cuffed. Just got flexed on. Well, what I was gonna say before that incident happened, I don't know if I'll be able to recover in time. Just it's over, but I think students, as we're like going out in the clinic, we tend to, within that specific dichotomy, we tend to gravitate towards the compassion side almost. And I think there's a little bit more that needs to come back to that firm instructional side. Like you have to make sure that patients are doing what you're telling them to do. That comes through coming across as knowing what you're talking about, number one, but also like not letting them off the hook, you know?
Yeah.
If someone comes in, oh, I didn't have time to do my exercises, and you're like, well, I'm just a student, I'm not gonna like, you know, go into this with them and like really push them. Get that out of your mind. You know, you need to, you're the one providing them the care, so you need to be able to be firm and push back when they're not doing something that will be helping them in the long run. So
Absolutely.
all right, so let's see, number 5 to wrap it up is, this one's more just an overall like experiential thing while you're at the clinic and operating within that environment. I said, have confidence and carry yourself like a professional, but respect everyone in the building. Just coming, you know, the idea that like you're not, so you're sort of hierarchy within the clinic. Yes, you're a student, so amongst the physical therapists, you're below them, but just everyone, like be nice to everybody. Be grateful for everyone for having you there, front desk people, other, you know, departments, if you're in like a hospital, just anyone there helping you towards having your success, be thankful and grateful towards them and share that in your actions. Like help them with things if you have the time. Don't act like you're above anyone.
Absolutely.
Yeah, that's a major part of being a physical therapist, is that interdisciplinary like connection. So even like PTAs, if they're there, I know where I'm going. There's like, I think on most days there's only one PT and like 6 PTAs. So I'm looking forward to that. Just like connecting to them and like being able to discern what patients are able to be seen by the PTA and which should only be seen by PTs, and working with there's a couple aides there too and 2 front desks. So yeah, that's a major component, I think.
Yeah.
And what better way to practice than in your clinical work before you graduate?
Yeah.
Right. Yeah. Yeah, that absolutely ties into patient outcomes once you're truly like treating your own patients. You know, if you're dropping the ball or being a dickhead to like the PTAs and the techs and all that stuff, it's going to lead to patient outcomes that aren't as great because they might not be working for you as hard as they're working for another therapist that they respect and respects them in return and gives them, you know, opportunities to show their professionalism, their skills.
Yep. Absolutely. A good way to think about it, like a good way to approach it during your clinicals, to try to make your time there as memorable in a good way for everyone there. You know, so like when somebody asks them about you, you want them to say that like, oh yeah, I remember him. He was great with the patients. He was great to the staff. You know, that kind of sets you apart from other students.
Absolutely. Yep, for sure. All right, I think that was a good discussion. So just to wrap things up, I'll go back over the 5. So yeah, number 1, willing to listen but not timid. Number 2, takes direction but doesn't expect everything to be spoon-fed to them. Number 3, competent with your hands-on skills but able to form a connection with patients. 4, being firm but compassionate with patient interactions. And wrapped it up with number 5, having confidence and carrying yourself like a professional but respecting everyone. So I may even make that a little post on my own BPT reality account, get some extra mileage out of that. But so don't forget to check out the Instagram and look for that post.
Write your own book, Chris.
The 5 rules to clinical practice. The solution to chaos.
Extreme clinical ownership. Just live off the coattails of Jocko and Jordan. So I thought the second half of the episode, we would just kind of like talk about some of our past experiences, maybe our expectations for this coming clinical. Why we think this one time around might be different. I don't know where you guys wanted to start with that, but maybe any good stories from last year's first full-time clinical?
I don't know if I have any like memorable specific stories, but just like the experience overall last summer was a really good one as far as like a first-time clinical, because I got so much like hands-on experience with patients. My CI was like fairly young. He was 3 years out of school.
Okay.
And the first week I kind of established my presence there. Like I made it known that I knew what I was talking about. I asked questions, kind of all the things that we covered, and kind of built his confidence in me so that he allowed me to kind of eval my own patients, treat my own patients. And I think after the first week, I, had 12 patients on my caseload, some of them that I evaled myself and some that were his patients. And for like the next 5 weeks, I just built on my caseload to the point where, my CI was kind of just chilling throughout the day. Unless we were like double or triple booked, he would take a patient here or there. But otherwise, he would just kind of hang out, like help me out if I needed it. So that was a really good experience, and kind of establish my knowledge in a lot of the things we learned. And then I was able to learn a lot of new stuff from him. He had just taken like the OCS and got his OCS. So like, he was studying for that. So he knew he learned a lot of new stuff that he was able to pass on to me, which is really cool. So I think kind of following those rules, the dichotomies that you established, that kind of let me build confidence in my CI and let him have me more freedom during the clinical, which is great.
Yeah, absolutely. Anything, KP? Any good stories? Any good patients?
Yeah, I had an interesting clinical rotation. So I only worked 4 days a week for 10 hours, but I switched every other day. So I got to see like a mixture of a bunch of things. Like 2 of the days I saw a lot of outpatient, both were outpatient, but a lot of orthopedic, knee replacements, hip replacements, stuff like that. And then the other day I did a lot of individualized planning. We were the only staff member in there. It was me and the PT. That was it. It was a really small facility, so it was a lot of one-on-one time, which was awesome. And then we also did a lot of workman's. It wasn't workman's comp. It was like workman's prep, basically like an FCE.
Like work hardening, I think they call it sometimes.
Yeah, and it was basically just like a screen to see if the worker was able to work that specific job. So that was really interesting. I don't think I'll ever be able to have that experience ever again. So it was nice to have that. But then this upcoming one is the same facility that's just set for my part-time. So I know my CI already. I know all the workers. That's why I know that the PTAs are there and the aides and the desk workers are there. But I know that most of the days we're the only PT there. So I have a feeling we're going to see a lot of eval, which is good, but also scary, because now I feel like we're done with our didactic portion. So we know everything. We should be able to implement all our knowledge into it, which is good, which is so scary, because if someone walks in the door, I feel like I should know exactly what to do. And I don't know if we're there yet, but I think it's going to be a good, scary learning experience. So I'm excited and a little nervous, but best way to learn under pressure.
Absolutely.
Yep.
Yeah. My first one last year was also, I think we all had really good experiences. I think that goes for pretty much everyone in our class too.
Yeah.
I was at a outpatient facility down in the heart of Baltimore. Shout out B-More. had one patient who came in, their friend had gotten shot the day before. So, you know, just the gritty streets of Baltimore, just in the trenches, helping out the community with their musculoskeletal issues. But we also had actually a good amount of FCE testing. So we did that, and that was interesting, like you said, KP, to see that. We had never really, I mean, we had talked about it, I think, at that point, maybe just initially in class, but I had never seen it and the process play out. And then just my CI, like you, Artem, she was, I think, 2 years out of school. So I think the benefit to that is they're more willing to quickly, like, throw you into patient care because they probably knew that's what they wanted as being a student at their rotations. So that was cool. And yeah, I think a lot of the same thing you guys said, just getting a lot of different, I think we were all orthopedic leaning clinics. Just a lot of experience working with those types of patient populations, seeing a lot of post-op stuff. I think that's one of the things that makes me like most nervous right now, because I think, you know, we talk about surgeries and rehabbing, but I don't know that we go too deep into like protocols and, you know, some of the specific like safety things. Like you can talk about it all day, but until you have someone like post-op ACL and you're trying to get them onto the exercise bike to do some like, you know, rocking back and forth on the pedals, that's kind of like nerve-wracking to be responsible for doing that. Like the last thing you want is to like not fuck up a surgery or something crazy like that. So, and then just understanding like they should only be doing this degree of knee flexion with exercises, really just having to stay on top of that stuff in your head. So anyway, I know KP touched on this year's a little bit. Artem, anything leading into this year's that you expectation wise or?
My clinical this year is actually going to be kind of like KP's second part was last year, where just me and another PT, and there's a lot of workman's comp and work hardening type stuff. So it's going to be a new environment for me, a little bit different than what I've experienced before, but make the most out of it. Again, it's just getting your hands on patients, getting experience. So it's all good.
Yeah.
Should be a good time, especially with the amount of time I have with patients there. Because I mean, with only one PT being there, you're not loading up the caseload. So should have more time with patients one-on-one, which is a good thing.
Yeah. I'm in line with you guys. I think it'll be a good measuring stick as to like where we are right now. I'm interested to see kind of like how I compare myself from last year to this year in terms of how comfortable I am with performing certain like manual techniques and just having a better, firmer handle on making an eval go smoothly, things like that. I'm at a outpatient clinic again, mostly sports medicine, orthopedic type stuff. It sounds like be in the pool 2 to 3 days a week. There's some aquatic therapy, so going to be an aquatics expert by the end of the summer. All about the buoyancy, so that should be interesting. We'll see what happens, but
we have 7.5 minutes remaining. You want to wrap this up?
Yeah, let's wrap this puppy up. I think so I guess the following episodes we can kind of give some live time stories and experiences of what we're going through with our clinicals over these next like 6 weeks. So yeah, we're on iTunes now. I think right now the first 6 episodes.
Yeah, first 6 are up. The rest are coming up soon.
Getting the rest up there. Today is 10, so we're into double digits now with episodes. Congratulations, guys, we made it. Against all odds, made it to episode 10.
The haters doubted us. We proved them wrong.
They didn't think we'd make it on iTunes, but
haters will say it's Photoshop.
All right, so we'll hopefully be back at it next week, and see you guys then.